microphone. I'm going to call to order this regular meeting of the Public Safety, Civil Rights, and Emergency Management Committee meeting. Today is October 14, 2015. I'm Councilmember Buang Yang, chair of this committee. With me today are Council Members Palmisano, Gordon, and Council Presidents Johnson. Councilmember Reich and Councilmember Warsame are on city business. Maybe one or both of them may join us at some point, but if they don't, they're taking care of some city business for us. With that, I will read the agenda for us. There are 3 consent items and there's 1 report. And the first item is a body camera implementation program grant award. The second item is a National Initiative for Building Community Trust and Justice Multi-Strategy Coordinator Grant Award. The third item is an Urban Area Security Initiative grant. And fourth item, which is a Receive and File report, is Domestic Violence Update Report from the City Attorney's Office. And so, council members, with that, the 3 consent items we will address first. Anyone with any questions on any of the 3? Councilmember Palmisano? Oh, okay, great. No questions. Being that there are no questions, all those, I will move all 3 items for approval. Any discussion? Seeing none, all those in approval, please say aye. Aye. Any opposed? Okay, those 3 carry. We will move on to the 4th item, which is the City Attorney's Domestic Violence Update Report. And we have the City Attorney with us today, Susan Siegel. So, Susan, whenever you're ready. I just saw you downstairs giving an interview, so hopefully it's the same thing.
Right. Mr. Chair, thank you, and thank you for giving us the time to make this presentation. Back in 2006, the City Council took a pledge to reduce domestic violence in our city. And a lot has been done since then. There's still a lot that remains to be done, I know, statewide. Statewide, we're already at the same number of domestic related homicides as all of 2014 in the city of Minneapolis. We do much better. We've had since January of 2012 between 4 to 6, depending on how you count them. But 4 to 6 is still way too many. So we know we have much work to do. October is Domestic Violence Awareness Month. And the work we've done in the city is we've created what we call the Minneapolis model for a coordinated community response to domestic violence. And so our office and the Minneapolis Police Department, I've got Michelle Jacobson, who is just a wonder, and will be delivering, a chunk of the report, who is the supervisor of our domestic violence team. We have Sarah Klein here, who is the executive director of the Domestic Abuse Project. Leah Martin, who's a family therapist from Domestic Abuse Project, who's worked with us on our Hotspots pilot that you'll be hearing about today. Ann Glidden, who is with Hennepin County Probation, and we've just gotten amazing partnership with them on our work. And then Bruce Fulkins, who as of Monday will be our deputy chief in charge of investigations in the Minneapolis Police Department, as well as our work with the Minneapolis Department of Health and Sasha Cotton, among others. And so we'll be focusing on a couple of our initiatives. We continue to keep an increased conviction rate. And I'm actually going to turn it over to Michelle now, who will provide some of the information on what we've been doing.
All right. As Susan said, we've been here annually, I think, since 2007, when we asked the council to adopt the pledge to reduce domestic violence in the city of Minneapolis. I know Councilmember Johnson was on the council at the time, and it was very warmly accepted by the council. And we've really worked hard every year to continue to find new and innovative ways to address domestic violence, which is happening within our borders. We're going to talk a little bit about the Minneapolis model, which involves our specialized team of domestic violence prosecution, our continued partnership with advocates in our domestic violence court, and then 2 new initiatives that we have, one which we talked a lot about last year, and I'll just give you some more updates on that, and then our newest initiative, which is the violent crime hotspots. So one of the biggest things is collaborating with our city and our community-based partners. We've drafted the Minneapolis model, which I am lucky enough to get a chance to train on all around the state. If they hear you do free training, suddenly you're very popular to go other parts of the state. So I've been to very glamorous locations like Mankato and northern Minnesota. We've done a lot of outreach and training for partners, not just me, but both within our police department, with the county attorney's office for new judges, statewide judges trainings, and probation officer trainings. Susan mentioned our conviction rate. It has remained steady since we implemented our new protocol for police officers in responding to domestic violence cases back in 2009, and we've managed to maintain a conviction rate just about 70%. I have our newest numbers for 2015, and they are at the 69% mark as of yesterday. We did receive a Federal Violence Against Women Act grant in 2014 that's good through the end of 2016, where we focus on the investigation of the misdemeanor and gross misdemeanor domestic violence cases. Our biggest partner in that initiative, who's not here today, is the Domestic Abuse Service Center based out of the Hennepin County Attorney's Office. We partner with Domestic Abuse Project, Casa de Esperanza, Asian Women United of Minnesota, as well as our partners in the police department. The grant funding has allowed us to have an investigator work on these gone on arrival cases where the suspect has fled the scene to do further investigation on those cases, and then they partner with a domestic violence advocate when they do their follow-up so that the victim can have services offered to them right in their own home. Our goals, I'm not going to go into them in detail, but really it was to do a better job on how we handle these cases, both in how many cases we charge, in how many services we're able to offer to victims, and how quickly we do our work. And I will say that we have been a resounding success in that effort. When we started this, the year before, we only charged 25 gone on arrival cases all year. Last year, we charged 109 cases. And this year, if our numbers stay on pace, we will surpass that, as we already had 64 cases charged through the end of the second quarter in 2015. Also, I would like to note that our conviction rate for those cases has remained steady at about 80%. Gone on arrival cases are particularly difficult to prosecute because if a victim does not show up to testify at a trial, there's no one there who can affirmatively say that John Doe was the person who did it, because there were no police officers who actually saw John Doe at the address. And so I'm very pleased to note that even though we're charging a lot more cases, we're not just charging cases so our numbers look better. We are still getting convictions on those cases so that offenders can receive services and victims and their family can have some justice. We've also greatly reduced the time it takes us to review the cases and to have those cases resolved in court. Those numbers show about a 55% reduction over the last, from 2013, and we're very proud of that as well. The faster you can get a criminal case to court, the better we are. When I do training for police officers, I like to tell them that domestic cases are more like Boone's Farm than fine wine. They don't age particularly well, and that seems to resonate with them and helps them understand better why it is so important to get the cases through the system in an expedient manner, because what studies tell us is that swift consequences are the most important in a domestic violence-related case. So I'm going to talk about our newest project, which we're calling the North Minneapolis Hotspots Pilot Project. What we know from past years of research is that there are about 17,000 domestic violence-related 911 calls in the city of Minneapolis each year. However, only about 20 to 25% of those calls result in police reports being made, which leaves a huge gap in services being offered to people where there's a 911 call but no follow-up police report. So what we did and this was also being done at the same time as the mayor's office was working on their burn planning grant for North Minneapolis with regards to the violent crime hotspots. So the police department identified the violent crime hotspots. What they learned was it wasn't the number one call for service in those areas, and all 6 of them was domestic violence related. So we began to study that information, and we saw that a lot of those addresses, or the majority of them, had multiple domestic violence related calls in a short time period. And this is what the hotspots area looks like. And they've remained constant for the last 20 years. And so what our goal really was to figure out a way to do something different so that in the next 20 years, someone who has my job is not standing here talking about how for the last 40 years, the violent crime hotspots have been the same. And so what we did was we developed a pilot project with generous funding from the mayor's office and the council and our partners include the police department, the city attorney's office, the health department, the Youth Violence Prevention Initiative, and the Domestic Abuse Project. Also, probation has been an official partner for us on this, as they're helping us provide more information about some of these homes. So what will happen is a team comprised of an officer from the 4th Precinct and a family therapist from DAP conduct a follow-up visit at these addresses where the 911 call was made. What the team will do is offer services, provide resources, and collect data about the home and family. And really our ultimate goal is to improve services and resources in this community. Talking about some of our additional goals really is to increase engagement between the people at those homes and uniformed police officers. I think Commander Fulkins, or soon to be Deputy Chief Fulkins, said it best earlier when we were talking. He said they want to see a police officer as a helper, not the person who's just going to take someone away. And so it gives the police an opportunity to go forward and build relationships with the children or the families in those homes. We also wanted to give victims and their families and offenders more information about community-based services, specifically related to domestic violence, increase awareness of these services, offer services to the people involved, and really then utilize the victim and family input to improve the system's response to domestic violence. So we started doing these home visits in April 13th to be exact. The team has made 291 visits between April 13th and October 6th. Leah is one of the therapists who partners with a police officer to go out on those visits. They visited 236 separate addresses, and 36 of those addresses, there were 2 or more DV calls. So in the majority of them, it's a one-time call. Astoundingly, the team is able to make contact with someone at those homes in 75% of the visits, which is a huge, because they're just cold going out there. They're not calling ahead of time to set an appointment, but 75% of the time they've been able to meet someone. Just a little bit of information about those calls. The majority of time it's the victim who's making the call or a family member. 84% of the addresses that the team has visited had prior reports within the last 3 years at that address. And we really tried to drill it down. If it was an apartment complex, we didn't say, oh, all of this building had calls. We really tried as much as possible to look at that specific unit or address when it was a duplex or apartment. And 34% of the addresses visited had someone on probation at that address. As I said, about 75% of the calls we were able to make successful contact. 64% of those people that we talked to wanted to actually talk with the team. About half of them accepted a resource handout that we developed, in particular with some help from the health department about community resources in the North Minneapolis area. And I'll show this on a slide in just a second. But what we learned is one of the questions we asked people, are you aware of where to go to get help? And a surprising number of people indicated that they did not know. And so the resource handout and some work we're going to be doing in the future as we continue to grow our work in this area will be to focus on what resources are needed and what can we do to make people more aware of the resources available for them. And what the therapist will do is leave a card with the people as they visited, and more than 19 people have made a follow-up call in response to that card, a couple days, a couple weeks after the therapist has left, because they do want more information, whether it be about domestic violence services or they've just become a point of contact for them. I talked a little bit about the lack of knowledge about services. The team made 15 referrals to domestic violence programming for offenders. 6 victims had safety plans written. 3 victims requested assistance with an order for protection, and we made 2 new police reports related to issues going on in the home. And I say we, but it's not really me, because I'm sitting in my office, with my feet up on the door or on the desk while everyone else is out doing the work. But I really feel like this has been another great example of the collaboration between all of our partners in looking at things in a different way so we can continue to improve how domestic violence is handled. So what are our next steps? Well, we're really going to continue to analyze the data that we've received to figure out how we can improve the response to domestic violence in those hotspots. And then really another thing we're hoping to do is really explore expanding the project to other parts of the city where there are domestic violence hotspots. North Minneapolis is not the only area where there is a lot of domestic violence going on. It's pervasive through every neighborhood in the city, and we would like to look at expanding that. And one area where we might be able to have some impact is the burn planning grant that our office received along with the city at the Little Earth area might give us an opportunity to reach in there and do some work with regards to domestic violence in the Little Earth area, because we do know from previous years' experience that domestic violence is a major issue there as well. I don't know if Commander Folkens has anything he wants to say at this point, or Sarah Klein, who's the Executive Director of DAP, or if you just want to start with some questions, but I want to give them a chance to speak if they would like to do so before I continue to hog the microphone.
Mr. Chair, I'm curious, something that I think I misheard at my table at the DAP luncheon yesterday was about the number of annual calls made that are domestic violence related in the home. I thought that someone at my table had said 9,000 calls and everybody was shocked. So to hear 17,000 calls are domestics in our city every year is
nope, that's all
in all of Minneapolis.
Okay,
it is certainly troubling. And could you tell us maybe how, if that has increased over time, or I think what might be the case is that we are able to categorize things differently, and that gives us a more accurate picture of this as a real difficulty in our communities. Do you know how this compares to other years?
Sure. Certainly, Councilmember Palmisano, Mr. Chair. We have seen a slight decrease over the last couple of years, but the 17,000 number has stayed fairly steady since I've been looking at the data, which is probably sometime in the mid-2000s. Some of it is a coding issue with the police. If someone calls in and says, I hear a loud noise coming from the apartment next door, historically police officers were not always good about changing it to an unknown noise trouble as opposed to keeping it as a domestic violence related incident. So I think we have tried to change that culture in the police department. They're doing a better job of that. But as we continue, as domestic violence becomes more in the news, I think we have more and more people realizing that the criminal justice system is a resource for them to address domestic violence within their home. And so the numbers have stayed fairly steady. One of the really interesting things as a part of this project is we're looking at the 911 calls that initiate this. And so it's been, and we're going to have some more data with regards to that as we continue to work on this project. But it was really interesting to see what the police are coding as a domestic, or 911 is coding as a domestic violence incident. And the next time we do a report on that, we should have some more information about what the nature of those calls are. Is it about a physical assault? Is it about a child-parent issue? And we're gathering some of that data right now. So look for that as we continue to report on this project about what is a domestic violence related 911 call.
Thank you, and thank you for looking to analyze this huge amount of calls in a thoughtful way.
Deputy Chief Falcons.
I would advocate for Sarah.
Okay, please.
Yeah, thank you.
Thank you, Mr. Chair and City Council members. I just want to reiterate the importance of this particular.
Could you introduce yourself for us, please?
My name is Sarah Klein. I'm the Executive Director of the Domestic Abuse Project. Thank you. I just want to reiterate Michelle Jacobson's comments about the importance of this project. Our work is really around ending and breaking the cycles of domestic abuse, and we can't do this work without our partners across the city. So we value the relationship that we have with the City Attorney's Office and the Minneapolis Police Department, probation, and all of the other entities that work on this issue. It allows us access to information so that we can get the resources to the community. As you heard in the presentation, a lot of the individuals that we've been visiting with do not know that there are resources out there for them. And so in order for them to be able to access them, we need to be at the forefront of getting to households so that we can get them connected to our amazing team as well as other agencies that are providing these incredible resources across the city. So again, thank you for your support.
Deputy Chief. Can we call you that now, or?
Not till technically Sunday, sir.
Okay.
Council members, thank you for just the opportunity. I just want to say that the Minneapolis Police Department is wholly committed to the issues of domestic violence and the mitigation of such. We really see in the Minneapolis Police Department that attacking the issue of domestic violence is going to have a positive effect in the future of our violent crime. It can't be denied that when you look at incidents of violent crime, when you start looking at the individuals involved in those incidents as perpetrators, victims, or witnesses to that if you drill back into their history, they all have one common denominator, and that's a violence in the home history. If we can intervene earlier, I think that generationally moving forward, we're going to make the city a much safer place.
Thank you. Council members, any questions? Council President Johnson?
Thank you, Mr. Chair. Just a curiosity, I think it's for Michelle, actually. So 291 visits were made. I'm sorry, 291 hotspot visits. Yep. What percentage of the people that had a 911 domestic abuse call then got a visit?
Well,
in
Council President Johnson, Mr. Chair, with this project in the hotspots, everyone who had a 911 call had some attempt from contact from the city.
Okay.
The only calls that we did not follow up on were ones where there was an arrest made. And we made contact through our office as part of the prosecution of the case, or the police department did. So all the domestic related calls, someone got a follow-up visit.
If they were in that hotspot.
In that hotspot.
Okay, great. Thank you. There was one other thing I wrote down here now, too. Let me think. Chief Fulkins talked about this violence in the home. You know, what's the next step then beyond this, where the victim gets notified of a potential for services for help? And I mean, what part of the work that we do, violence prevention, youth violence prevention, involves some aspect of this to young people about domestic abuse?
Well, Council President Johnson, Mr. Chair, I think we have been partnering with Sasha Cotton in the Health Department and the Youth Violence Prevention Initiative. We're sharing our data with them because we're asking a series of questions. I don't want to go into that to bore all of you, but really what was to find out who's living in that home, what's going on, so that we can better analyze both how we're providing our services and what additional services are needed in those areas. And we are asking questions about how are the kids doing in school? What services do you need? We're making offers of services to the kids, and that's on the resource handout we have for them. So our main goal really is to raise awareness of this, because one of the things, and I'm not a domestic violence service provider, but one of the things I've noticed in my years of doing domestic violence prosecution, a lot of times it's not the first or second time that we talk to someone about something. It's the fourth, fifth, or sixth time that, someone talked to me about that resource a couple months ago. I wasn't ready for it, but now they have it. And so that's our real long-term goal, is that we can continue to gather a little bit more data, share that with the Youth Violence Prevention Initiative, because they're the experts at that, not me, but, and then figure out better responses and ways to stop that cycle.
Great. Thank you very much.
Councilmember Gordon.
Thank you. And just on that note, the Youth Violence Prevention Executive Committee has been looking at being exposed to violence in the home and what a risk factor that is then to being a future victim or perpetrator of violence. And there's a definite connection there. And so this is one of the flags that could trigger getting some resources. We do have a program now that we have a contract with, I think it's Sarah Tubman, to provide family services for those who want. And this might be one of the things. There really isn't maybe enough money right now to get to all the kids. But I really appreciate you bringing that up. That's key. So it'd be nice if we can be kind of tracking that and trying to get some resources to those kids who are exposed to some of this. I also had a question because you talked about citywide and hotspots. And so is there a map that identifies other hotspots in the city that could be available for council members to look at and better understand this?
Mr. Chair and Councilmember Gordon, yes, the police department has an amazing ability to map different things. And the map I showed you was done by Sergeant Jeff Eggy in the police department. And that was really just historical data that they could map onto in a program that can analyze the data and could tell us what the hot spots were. They have amazing capabilities there. They're underworked and understaffed to get everything that we all want, but they do have amazing abilities, and they've been using that within the police department to do some of their smart policing, figure out where they need to place squads at times. But yes, that is available. Well,
I would appreciate maybe getting an electronic version sent, and maybe other committee members would too, so we can see where, especially looking at the parts of the city that we represent. I'm also concerned about underreporting that still goes on and how people define domestic violence. And I think there may be more going around the University of Minnesota that's kind of maybe it's not quite domestic, but it's acquaintance, it's friends, it's boyfriend, girlfriend kind of things in relationships, and violence it might become a part of that. And I think it's often underreported, especially early on. So we probably don't have a map that shows where the calls come from, although maybe that's part of what makes it into a hotspot. Mm-hmm. So it would be interesting to see that as well. And of course, I think reports like this and the more press we give to this and October and awareness will help people see that calling makes a difference. And hopefully we'll get more people to call and we can address that underreporting. And I had one last question because you talked a lot about the addresses, but it wasn't clear to me whether you were talking about the same families. And I'm assuming some of those addresses may have been the same families, maybe the same two people involved, and some weren't. But can you give me a sense of if these were actually the same people that had been visited at that address previously, or were most of them different people?
Right, Councilmember Gordon, Mr. Chair. We did some initial digging into those more carefully at first, and my first guess, which was wrong as it often is, would be that it would be a lot of different people who had lived there. But it was surprising the number of those addresses where there had been long-time residents there. And so there is a high, there's more people who are staying in a stable address than I thought there would be. There's certainly some of that where when we look at the prior police reports, one of the things that we note on there did involve the same parties or other parties. And I don't have an exact number I could give you right now, but there are larger percentage than I thought that would be, even if you look back 2 years, it's the same people living at that address.
Well, I think that's good information to have. I think sometimes we put too much emphasis on thinking it's associated with some part of the city, when actually this is probably it's because people were living there all that time and we hadn't helped them, or they hadn't got help for the issues they were dealing with. Thank you.
Councilmember Palmisano.
Thank you, Mr. Chair. Ms. Jacobson, could you help us understand how the county has been involved within these hotspots with the social services they offer? And I ask it from the aspect of being concerned and spending all of last night in my own neighborhood in a complex social services problem where people next door have been noticing domestic situations for over 20 years and have still not been able to get Hennepin County Social Services to do an intervention. And, you know, that aside, I'm just curious, what role does Hennepin County play in this pilot, or how are they contacted, and how did that work?
Sure. Thank you, Councilmember Palmisano, Mr. Chair. We have started to do some outreach with the County Human Services Department. They will be coming to our next meeting as we talk about next steps and ways that that the system can provide more services in those neighborhoods, and not just provide more services, but make people aware of what those services are. So we have been talking with the county, and they will be coming to our next meetings. We also have a representative coming from our next meeting from North Point, which is kind of a nice center in North Minneapolis for people to go to, and their medical director will be coming to because what it is it's kind of the idea of making people more aware of what's out there, but we do hope to build more relationships within the county so we can have it. I believe our therapist called it a warm handoff. So you don't have to just say, oh, call this number. We can actually build some connections so that there is more of a warm handoff, so the person isn't just given 12 numbers to call and it's overwhelming, or they don't have a phone. So we are hoping to build more connections with the county resources at the next meeting.
Mr. Chair and Councilmember Palmisano, if I might, that's been one of the interesting things I think we've learned is being a little more proactive about connecting with the people who need services. And the DAP family therapist is actually in some ways becoming the coordinator, because they've seen her face, they know how to reach her, they've spoken to her, and so she's somebody that they will contact instead of trying to deal with the morass of trying to find the right phone number to reach County Human Services. So I think this is an exciting opportunity where Michelle is now invited in.